Good day, ladies and gentlemen. My name is Dr. Sean Terrence Armstrong, and I'll be taking you through our COVID emergency pack. So with COVID, we have to hit it hard, early, and with combination therapy. I'm just going to take you through so you understand how to use the pack and the script and everything that's included in there. So we've got your C-Guard immune booster. This has everything to boost your immune system to a certain extent. You have one of these orange capsules 2 to 3 times a day. There's the 1 gram anti-inflammation cocktail. It's all herbal extracts, and there's 2 capsules, a yellow and a blue capsule. You have one of each 2 to 3 times a day. You have your HexiGuard antiviral saline rinse. You'll use this 2 to 3 times a day. Aim towards the same eye you're putting it in a nostril. Squeeze in a neutral position, both sides. Do that 2 to 3 times a day. You've got your Sinus Relief. The Sinus Relief is made of menthol, eucalyptus, camphor, cayenne pepper extract, and limonene. You put 5 to 10 drops in a small container. Put boiling kettle water in there. Cover your head with a towel and steam yourself for 10 minutes, 2 to 3 times a day. Your paracetamol, you'll have 1 to 2 tablets 3 times a day. You can have it 4 times a day and make sure there's a 4-hour gap between. Then you've got your EENT. This is an antiviral back of the throat wash. So you'll take 10 clicks, put it in the back of the throat and gargle that, and that will help with the sinus rinsing and the steaming, decrease the viral load in your upper respiratory tract, so you've got less virus coming down to your lungs. Okay, we've got your tongue depressor. You can see the back of the throat, if there's any redness, and also for teleconsult. Then you've got your thermometer. The thermometer you read on the last black line is the accurate reading. Leave it underneath your tongue for 1 minute. So as additional part of the pack is suitable for 2 people. So if you would like to use it for 2 people for 3 days, there is adequate products in the pack, or 1 person for 6 days. But normally 3 days is more than enough, especially if you start early. Okay. So additional to the pack is we've got the HexiGuard 75% alcohol sanitizer with the tea tree oil. And what we do is in your pack you'll get your ivermectin liquid, and with the 1 syringe that doesn't click, you'll put that into your sanitizer, close it, shake it up, and every time you sanitize you'll have a very thin layer of ivermectin on your skin, which is proven in clinical studies to kill the virus in direct contact. Then we've got your mask sanitizing pack. Now in there you've got your instructions. This helps prevent sinusitis and upper respiratory tract infections, and it's ideal to sanitize your mask at least once a day. So you take your pouch, you've got your 100 ml HexiGuard mask sanitizer in there. Take the proppy off. Then there's another click syringe in your ivermectin liquid pack, and you'll put that in there and just do 10 clicks in there. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Shake it up. And then you get your Star Shield mask in the pack as well. So what you can do with that is you can use it as a mask and shield, and it's quite nifty that it just shifts to the back like that if you're not using it. Okay, so we're going to show you how to dismantle it. So we take the clips off. And then you've got your mask. Put it in your sanitizing pack. Pour your sanitizer in there. You can do the whole bottle. Close it. Shake it up. And then your mask is ivermectinized. Squeeze it dry. leave to dry for 3 to 4 hours. And if you need to go anywhere while it's busy drying, you've got your 2 extra masks in there, and then your spare gloves as well. Okay, so that's the complete pack, and we'll just take you through the ivermectin liquid. So the ivermectin liquid, there's one syringe that doesn't click, and there's one that clicks. And of course, you'll make use of this as per instructions on this pack over here. Just know that it's an animal antiparasitic. It's repurposed medication, and it's ideally suited for preventing cross-infection from animals to humans, or humans to animals. So if you were playing with your animals and you're COVID positive, make sure you've got the sanitizer on to prevent the spread from you to them, and then your animals to your neighbors or something like that. Very critical. You've got a complete script. So of course, we modify this according to your need and your other medications and your allergies and that. Just be careful of allergies. It's a 3-day treatment pack of medication, and this you can get at any pharmacy. Medications are affordable, and they're for 3 days. You'll get your blood form. If you need to do any follow-up bloods, if you're already progressing to stage 2 or 3, we can pick that up in the blood and get you some help earlier than later. And that's that. I just advise you to look after yourself and try and boost your nutritional diet with nice immune boosting foods such as shiitake mushrooms, preferably not to be fried. Put them in the sun for 8 to 10 hours to boost their vitamin D content, and use them for boosting your immune system. It's one of the most potent immune boosters that you can get in natural form. It's shiitake mushrooms. You can buy them at Checkers or just search online. Thank you very much.